The Tom Woods Show, episode 651.
Prepare to set fire to the index card of allowable opinion. Your daily dose of liberty education starts here. The Tom Woods Show.
Folks, if you enjoy this show, you're really going to like the free course I've made available to you on the real history of the U.S. presidents. Very, very helpful, especially during an election year. Check it out at freehistorycourse.com. All right, I'm going to give you 2 seconds to imagine the most fun a person can have, and then we'll compare notes. Ready? Go. All right, I'm sure we came up with the same answer. Joining Bob Murphy and me on the Contra Cruise in October 2016. Fun, games, music, and hilarity. And with nearly 6 months still to go, we're already nearly half full. Grab your spot at contracruise.com. Hi, everybody. Tom Woods here. We're going to be talking today about the intersection of Austrian economics and medicine, but in a way I've never seen it done before. Our guest today is Dr. Michel Akkad, who practices cardiology and internal medicine in San Francisco. He has a blog called Alert and Oriented, which you can visit at alertandoriented.com. And he recently gave a very interesting paper at the Austrian Economics Research Conference held annually at the Mises Institute. And I was listening to the delivery of the paper. I was not at the conference, unfortunately, but I heard it online. And I thought, all right, let's talk about this, because what interests me is that it's odd to see how difficult a time the medical community has defining the very concept of health. What is meant by health? And Dr. Akkad has an Austrian-inspired definition of health that seems to be a better definition than the ones that the medical profession sort of tries to grope towards. So it's very interesting. Plus, on medical licensure, Dr. Akkad has written a bit about the lack of need. I was going to say about the need for medical licensure, actually that there isn't a need for it, and that's a really difficult argument to make, isn't it, as libertarians? Nobody believes you when you say that we don't actually need this. We don't need medical licensing. People think you're crazy. There's no way anybody can accept that. So I want to talk to him about that as well. I'm going to be linking to his blog where he's got bits and pieces of that paper that he gave, which hasn't been published yet, but you can get the gist of it on his blog. I'm going to link to his blog and his Twitter over at tomwoods.com/651. I might add also, and this has nothing to do with why he's on the show, that Dr. Akkad is actually a supporting listener of the Tom Woods Show. He's the second supporting listener to actually be a guest on the show, comedian Dave Smith being the first. Dr. Akkad, welcome.
Thank you for having me, Tom.
You gave an interesting paper at the Austrian Economics Research Conference this year, so interesting that Jeff Deist, the president of the Mises Institute, devoted a whole episode of his Mises Weekends interview show to just playing the recording of your delivery of the paper. So, in fact, I tuned in expecting to hear an interview with you, and it was you delivering the paper. So I thought, wow, Jeff must really think highly of this paper. So I wrote to you, and I said, send me that paper. Let's talk about it. So I do want to do that, and maybe we'll go off on some digressions, because I've seen that you've written on a number of health-related topics on Mises.org, so I feel like I can hit a lot of things and not worry that you're going to say, this is not my area. It seems like everything is your area. Let's start with,
right.
I do want to talk about this theme of man as machine, but before we do that, I don't know if we can do this before we do that. What struck me most about your presentation was that when you ask professionals, and you ask people even of different schools of thought, what is health? What is health? What do we mean we say that someone is healthy? It turns out that there is you don't really get a satisfactory answer.
That's exactly right. It's really the elephant in the room. I think I called it the elephant in the room in the talk about healthcare, is that there's no accepted definition of health. And that's actually, it's not just me saying that, it's well recognized that there's no consensus on how to define it, that it's a matter of debate. But the debates are not in the medical mainstream literature or in medical school or anything like that. It's sort of been confined to the philosophical journals that nobody reads, and the whole healthcare machinery goes on as if it wasn't a problem.
But it seems like it is the problem, isn't it?
I think so. I mean, so that's essentially my thesis. My thesis is that the reason we're in such a mess is because there's no good conception of health, or there is one or a couple, and they're faulty, and they allow a lot of interventionism essentially.
Yeah, that's where I want to go. I mean, I want to talk about what you've done in this paper is really amazing. I think I didn't think what you did in this paper could be done, because every time I see somebody try to say, "Oh, this is a praxeological approach to such and such," it's a big flop and it makes no sense, right? But yours is really well done. So let's start with let's look at definitions of health that don't really work. Then I want to look at your definition of health, and then bring in, where necessary, the idea that became current in medicine of treating the body as if it were like a machine.
Right. And one thing I'd like to say here is that I hope that, when I say my idea or my proposal, my intention is not to sort of fabricate an artificial concept of health, but on the contrary, to try to restore what might be a natural meaning to it, or a common sense meaning. And of course, I use some, praxeology or whatnot, but the idea is precisely that the healthcare system is founded on an artificial idea of health, and we need to go back to the original meaning of it, the natural meaning of it, and when you do that, then you can see that any form of interventionism is only going to lead to trouble. So what I did, I tried to trace a historical, to go back to the ideas that have shaped the current healthcare system, the ideas about health. And we can actually do that specifically in the US, because here in this country, which is unique, there was a period of time, the mid-19th century, where healthcare was actually a complete free market business, And so what you had at that time, you had competing medical schools or schools of medicine, not medical schools, but schools of medicine, competing notions about what health was. And they were not necessarily always explicit, but some of them were more explicit than others. But there was one concept that emerged that was part of the movement within science, that was sort of an ideological scientism, if you will, or ideological positivism, that started to view the body, given the successes of the scientific methods, given the successes of physics and chemistry and whatnot, started to really conceptualize the body as a machine, and that had a lot of appeal to social progressives. Who also wanted to manage society according to scientific principles and whatnot. So you had a marriage of these two movements that gave rise to the licensing laws and the licensing reforms of the beginning of the 20th century, that essentially embedded into medical practice a certain view about the human body, a certain conception. That was, yes, the body is a machine, that we need to train experts that are going to be, essentially very technologically versed or scientifically versed to study the human body that way, and that will be, lead to great things. And it's not that the model is completely wrong. There are certainly aspects of the human body that are like a machine, and it's very useful to think of the body in some ways as a machine. But it cannot be the end all be all of the human person. And if you restrict your frame of mind or frame of thinking about health to the machine concept, then that's when the problems start to pile up over the years and over time.
All right. So if it's wrong to think of the body as a machine, even if for some in some theoretical ways it can be helpful, how should we look at the body then? If it's not a machine, then what is it? I mean, I guess it's tempting to think of it as a machine because you think that, like a machine, it behaves in predictable ways, and that's why we can study it, because it behaves in predictable ways. So then what makes it not a machine?
So what makes it not a machine is that, we have minds, and we are going places, and we act, and we have desires and preferences and so forth. I mean, that's one way we're not like machines. It's also important to understand how, if I may just spend a couple minutes on how the machine concept, how it went awry after the enactment of licensing laws.
Yeah. Do that. Yeah.
Because people don't realize that the licensing laws, the way they're very closely connected to the accreditation of medical schools and the curriculum of medical schools. So the licensing laws essentially standardize the medical school curriculum into a way that essentially embraced this machine concept. So you learn about, you don't think about health, but you learn about the machine. So you start with the components, you start with the building blocks, sciences, organic chemistry and biochemistry and anatomy and whatnot. And you build on that. It's like a constructivist approach, if you will, to the human body without thinking too much about the concept of health or the good of the person or things of that nature. And of course, the machine model is fruitful from a therapeutic standpoint. You can find drugs, but you can identify defects in the machine and so forth. So it has value there. But what it does, it doesn't allow for health, for an understanding of health, if that's all you limit yourself to. Because to talk about health, you have to bring in other considerations. As I mentioned, what is the good of the person, what is the integrity of the person, that sort of thing, which you cannot get out of physics and chemistry, so to speak. And furthermore, what it does, it changes the culture so that the physician is viewed as the complete expert and the patient as the subject, right? So you have the object, if you will. You have this situation where, and it was the case after the enactment of licensing laws, you have the rise of what's called medical paternalism, which was really pretty virulent in the first part of the 20th century, where doctors could really, they were praised by the system and sort of elevated to a status of demigods, and whatnot, with all this scientific power at their disposal and so forth. And patients were really treated very poorly. And then it also gives license to the medical community to identify all kinds of, to medicalize all aspects of life. Because, there's no end. If you view the body as a machine, there's no end to the kinds of defects that you can identify or whatnot. And so you have this relentless temptation to just butt into people's lives and tell them what's wrong with them and so forth. So I think it's helpful. It's a helpful model, the machine model, only if you restrict it to its proper place, which is, to give you some ideas about the physiology and the structure of, the effects of medications and so forth. But it cannot be the overriding model for health and for medical care, for the medical encounter.
All right, to help people understand this a little bit better, let's imagine a patient comes into your office and is complaining about something wrong. How would you look at the question differently from how a doctor who believes in the machine model would look at it? Aren't you both looking at the same books and thinking in terms of the same symptoms and so on? How are you looking at it differently?
We actually are probably thinking about it the same way, in that most doctors, just to make that clear, are good doctors and naturally don't view typically won't view the person as a machine. We're all humans and we instinctively treat people as human beings. But one thing that I wanted to sort of add, and I'm sorry if I didn't, to this machine concept, the machine concept, once it was essentially embedded into the licensing system, it gave the opportunity for third parties to start to insert themselves into the healthcare encounter, because remember that this machine concept defines the notion of health or of disease as a defect in the machine, and health as the absence of disease. That's sort of the paradigm, the implicit paradigm, if you adopt this machine concept. And so it views the work of doctors as purely technological and sort of an expertise in technological. So it's very tempting from then on for regulators to come in and supervise, or subject healthcare to quality regulations and safety regulations, and you get a lot of oversight. The sort of get in between the doctor and the patient, and try to control what doctors do and what patients do and so forth. And then you have additionally, you have the concept that if the body is viewed as a machine, and this concept, and health is the absence of defects in the machine or diseases, then healthcare becomes an insurable event. So you have the idea that you can insure healthcare. And I'm mentioning these because they're really important, clearly very important aspects of how people practice medicine that have been around for decades now, really since the 1920s and 30s, and have always failed at what they're trying to do, trying to improve the medical system and the medical encounter. They've always failed, and you've had more and more regulation and more interventions because it's all based on this very mechanical conception of health, of what health is. Now, when people come to my office or they come to another doctor's office, we practice medicine. If we practice good medicine, we do it in spite of that entire, burden of regulation and interference and whatnot that is there by virtue of the prevalence of this mechanical concept of health. And we actually try to deal with patients, as human beings. But the more the system interferes, the outside healthcare system interferes because it's been built on this misconception of health, the more difficult it becomes for doctors to take care of patients as human beings, to take into consideration what their preferences are, what their goals in life are, what their aspirations are, and to deal with them sort of more humanely. So it's not a very what I'm saying is my conception of health is not like it's a revolutionary thing, but it's just a recognition that if you have a healthcare system that is built on this faulty machine concept, then it will, in many ways, screw up the way doctors and patients view each other and deal with one another. Does that make sense?
It does. I'm thinking about I think it might have been the World Health Organization's definition of health, where where health is more or less the absence of defects. And one of your points was that this would mean that a blind man could never be said to be in good health, even though if you ask blind people, they would say, I'm in perfectly good health.
Well, actually, let me clarify that. So when the machine concept was sort of adopted in many Western nations, at the turn of the 19th century, the beginning of the 20th century, and sort of under this positivist sort of scientific hopefulness that putting doctors as experts and viewing the body as a machine and whatnot would solve all our problems. And when that failed to materialize and in fact led to a lot of medical paternalism and abuse of power by the medical community, including the abuse of power that occurred in the 1920s and 30s under the eugenics movement, where people were really mistreated from that. There was a reaction to that after World War II, a reaction to this highly mechanical conception of health. And one expression of that reaction was the World Health Organization said, no, this mechanical model is not sufficient. What is sufficient? What we need to do is define health as, well-being, physical, social, and mental well-being, not just the absence of disease or infirmity. And that's in a way it's an improvement because it takes into consideration the subjectivity of the person. What people want and their well-being and so forth. They're not, we're not supposed to view them as machine. And so forth. But on the other hand, it's also a faulty concept because you can't just say that health is the absence, you can't equate health with well-being. You would never be healthy if well-being is your standard of what health is. Yeah, I don't know about you, but I have a little, in the course of the day, there are many, many times where I don't feel perfectly well. And it does nothing to restrain the scope of medical care. In fact, it expands it because if if well-being defines health, then we can. There's all kinds of normal life, normal life situations that become fair game for the medical system to intervene on.
Okay, give me an example of that.
All the take Thomas Saz, the psychiatrist, was very big about talking about the influence of the psychiatric, the interference, how everything has been medicalized, how psychiatry has become, had invaded, everyday life, by having human beings seek out medical care or psychiatric care for problems that are not medical per se. There may be social problems, or maybe this, everything. Now the tendency is to go to the doctor, to find solutions to a huge number of problems, because we don't feel well, when in fact these are not necessarily or inherently medical problems, or they're not inherently problems of health. If we were to understand health more properly, and this sounds perhaps a little abstract, but I think most people recognize that there's just, you can't open a magazine now without having a medical doctor give you an opinion about something or other that actually used to be the realm of what your mother would have would be telling you about what to eat and that sort of thing, and not having doctors interfere and intervene into every single aspect of our lives. You know what I'm saying? From what we eat, from how much we should exercise. Everything has become sort of a matter of under the purview of the medical lens, or the medical world. And it's because in both ways, whether you talk about the machine concept, the mechanical concept of health, or the well-being concept of health, both of them view the human person as sort of reacting to things, reacting to the environment, a victim of disease or illness, as opposed to viewing the human person as an acting person, as someone who's going through life, making choices and going places and having a certain having intentionality in what they're doing. None of that is present in the two concepts of health that I mentioned. The two prevalent concepts of health, whether it's the machine concept of health or whether it's the well-being concept of health. It really ignores the fact that human beings are acting persons, and that's where I was inspired. When I discovered praxeology and the philosophical underpinnings of economics.
Do you mind if I jump in here? Because
yes,
I want to make sure, because we use the word praxeology like it's the word butter.
Right.
But you have to, I have to always remember that not everybody knows the word praxeology. In fact, when early on, when I was on a date, and I was told that the word praxeology, that was a fake word. That word did not exist. So it does exist. There is a word praxeology, and what we're talking about here is the methodological underpinnings of the Austrian School of Economics, which is a frequent topic of the show. And the basic idea of it is that it's a non-empirical approach to economics and the social sciences that builds on certain axioms. And the foundational one is the axiom that human beings act, but by which they mean that human beings use the scarce means of this world in pursuit of their ends, and they have a ranking of these ends, and they have preferences and so on. And from this basic idea, we can derive the concept of cost, of opportunity cost, of value scales, of diminishing marginal utility. A lot of economic concepts can be teased out of this basic insight. So this basic insight that human beings pursue ends using scarce means, this is the insight that Dr. Akkad is talking about. All right, so now we return to our regularly scheduled program here, and you jump back in, and now that we know what we're talking about, go ahead.
No, that's correct. So, essentially it recognizes that human beings are as you said, are intentional in the way they live their lives. and they're not like animals, sort of reflexive or instinctive in their, and they're not like rocks and chemical elements just bobbing about according to the laws of physics. There's an intentionality to human action, which is forms the basis of the economic science, Austrian economics. And you're right in that human acts, and therefore they seek they seek out external means to achieve their goals, but they also need internal means to achieve their goals as well. They need to be in a certain physical condition, and they need to have certain mental capacities to achieve their natural goals. And that's where I thought it was helpful to start thinking about health in terms of having the internal means of action, of in a way that you're healthy when you have the physical and the mental condition to go about life to achieve your natural goals and your natural aspirations. So I was getting inspired from the way economics has developed based on the axiom of human action. I was inspired to find this concept helpful to identify a conception of health as being the state that occurs when you have the physical and mental capacity to go about and live your life. And disease occurs when there's something wrong, when there's something wrong either with your physical condition or your mental condition that interferes with your ability to go through life, intentionally the way human beings do. Does that make sense?
It does. Now, I can understand how that definition of health is more intellectually satisfying, but in the actual lived experience of human beings, how could the widespread acceptance of that view of health have good consequences for us all around?
Right. So I admittedly, it's theoretical, and admittedly, so long as the medical education and the licensing laws and the entire system is not going to accept this model, I realize that I'm being theoretical. But nevertheless, I think it's important to have at least some conception of where we've gone wrong and where we might go right or correct the problem if we did so. And the way it's helpful is because then the relationship between the doctor and the patient changes completely if you adopt this model, because now the doctor is no longer going to view himself or herself as an expert dealing with a subject, right? The doctor is going to view the patient as autonomous and a human person acting who's having difficulty going through life and achieving their ends, due to an impairment in their physical or mental condition. And the patient, therefore, is seeking out the doctor to help restore those internal means of action, their physical condition and their mental condition. So the patient goes to the doctor to take over essentially those means of action and restore them to their natural state. And therefore, I think that I use the word stewardship or steward for what becomes the essence of medical care. The doctor then becomes a steward because the patient is, due to the condition or the illness, helpless in taking care of themselves and moving forward. So they come to you and they put into your hands their physical condition, and it's your job to be a steward and then to restore them to their proper condition. So in a way, you have to adopt the point of view of the patient. You have to understand what their goals in life are to a certain extent. If somebody comes to you with an acute bronchitis, their goal in life is to get better immediately. So you don't have to know exactly where they want to be 15 years from now, and so forth. But there may be situations where they want to be in the future, in the long term, is important, and so you need to take that into consideration. So if you, as a doctor, view yourself as a steward, your approach is going to be very different from the approach that you might have if you view yourself as the expert and you view the patient primarily as, a subject or a machine that has a defect that you need to fix. Does that make sense?
It does. And I feel like I have to ask you this. It did come up briefly in your presentation, and I'm afraid, even though I have notes and I cross things out that I asked, I'm afraid I'm going to forget this one. And I always want to ask. I want to ask you, and every doctor I have on, I want to ask this question. And it is, as I say, it is indirectly related to what we've been talking about. The whole question of medical licensure. Now, you are a successful physician, and yet your view is that the existence of medical licensing is an unjust imposition on the liberty of everybody concerned. And yet the vast majority of the public would think that is a crazy opinion and that you are going to subject us to quacks.
Yes,
right?
yes.
So
of course.
How can you justify yourself?
It's easy. First of all, if you look at the historical record, medicine became a lot more dangerous after the enactment of licensing laws than it was before. It's sort of... people let down their guard. They were told that, the state had vetted all the doctors and they would be safe. When in fact, what it had done, it had empowered doctors and by then they had the scientific means to do a lot of harm. So they were a lot more harmful than the snake oil doctors of the old days. And then if you look at how medicine was before the enactment of licensing laws, it was getting better and better. And there's one paper that I wrote for Mises.org that looks at the Mayo Clinic. And the Mayo Clinic was born of the free market. So the finest institutions, medical institutions in this country, the Johns Hopkins, the Mayo Clinic, the Boston hospitals and whatnot, were all born from the free market. And what was happening is that they were actually putting the quacks out of business. The quacks were not surviving; they were disappearing. And the licensing laws had nothing to do with medicine getting better or more scientific, in fact, if anything, it derailed things because it forced this artificial concept of health that I mentioned about, this machine concept. It forced it and made it sort of a quasi-reality. Whereas before, doctors, at the Mayo Clinic and whatnot, they were using science for sure. They were using science and technology because they were, trying to help the patients, restore them to their natural health and their natural state. But they were not so mechanical or so callous as to view themselves as, the expert, who were granted now a privilege from the state to do whatever they wanted, essentially. So you can refute it. Now, I understand that it's a tall order from a public relations standpoint to sort of make the case that medical licensing is not helpful, but I think it's a fact. I mean, it's undeniable if you look at the historical record.
And then, there is, of course, the fact that today, especially in the days of the internet, anybody can check up on anybody. In 2 seconds, you can immediately find out everything you need to know. We're living in a world no one could have dreamed of back in the horse and buggy days when they thought that a medical license was what was necessary to save everybody. Of course, and it artificially restricts medical services, doesn't it?
True, it does. It does. It restricts medical services. It makes, and then it's the medical. The promise of licensing actually clearly failed. And even by the medical community's own standard, they keep saying, they keep imposing on doctors more and more requirements in terms of certification and licensing and hospital and continuing education. And there's no end to what they how can a third party, sort of a third person, vouch for the integrity and the ethics of a doctor? They can't. All they can do is test their ability to, answer a complicated multiple choice exam, which most of the time has nothing to do with, the actual taking care of patients, and it restricts the pool of people who might get into healthcare. And it makes healthcare more expensive. I trace the economic consequences of medical licensing in America, and it's one thing after the other. When medical licensing laws were enacted, it put out of business a whole bunch of medical schools that were deemed unscientific, and it's really made access to healthcare a lot more difficult and a lot more expensive. I mean, there was almost immediately after the enactment of licensing laws, there was a huge, the first crisis of medical cost inflation. So in the 1920s, everybody was worried about, why medical care was so expensive all of a sudden, and never traced it back to the licensing laws. And the response to that was to add more sort of interventions and to try to concoct health insurance schemes to try to answer that medical inflation problem. So I don't want to take too much of your time on this particular subject, but you're right. I mean, I think medical licenses are the beginning of the healthcare system, and they contain all the seeds of errors that subsequently unfolded over the decades.
The paper you gave at the conference, are you planning to get that published somewhere?
Yes, I certainly would. I'd like to have maybe two versions of it. One that would be more for the the Austrian school folks, economists, because using the concepts of praxeology that I talked about. But I could also make a version more easier for the lay or the medical community to follow. That would, because most people intuitively understand, when I blog about these ideas, they're not really controversial. People recognize their value, except that this entire history of our medical healthcare system and the history of our concepts of health, nobody talks about it. When you go to medical school, you never have once a class or a course or any discussion about what health is. And so I don't think it will, I think it will appeal to some people to sort of try to put the two together, or try to recognize what we talked about at the beginning, this elephant in the room, that our conceptions about health or our operational concepts about health are really faulty.
And that's what surprised me the most. It just, not being a medical student, I had no idea what was taught or how it was taught or whether there was I just assumed that they could define what health was.
That's right.
I took that for granted.
That's right.
All right. Well, listen, I want to, when either version is out, I want to make sure and link to it. I'll go back and, retroactively and link to it at tomwoods.com/651. So for now, just bear in mind there's a Dr. Akkad-shaped hole in that show notes page, but it will be filled someday when it gets published. I appreciate your time and also your willingness to talk to me very much at the last minute, and thank you very much for that.
Thank you very much, Tom.
All right, everybody, a couple things to tell you about. Here's an interesting new website I bet you'll want to check out. I love the name. It's called The Mean Austrian. Mean, like grr, mean, themeanaustrian.com. And the idea behind the Mean Austrian is you're going to get a lot of blog posts that are really meaty, you're going to learn a lot from, but in which, by and large, people who are associated with libertarianism but who are not Austrians per se are going to be shown where they're wrong. I mean, that is to say, they're going to point out on this blog exactly what the shortcomings of these otherwise good people are. Because they don't have Austrian insights, they sometimes go wrong. So this will be so this is the sort of site that'll drive some libertarians crazy. Oh, you shouldn't ever criticize a libertarian. But it's not really there's nothing mean about it, even though it is called the Mean Austrian. But on there you will see, okay, well, I see where Thomas Sowell is kind of missing the boat on this particular issue, or Milton Friedman is missing the boat on this particular issue. It is helpful to clarify these things, right? I mean, maybe some people don't like doing that all the time, but then don't go to this site. But for people who really want to have crystal clarity and who want to understand where people we otherwise respect maybe do go wrong, then this is a brilliant, if you ask me, it's a brilliant site idea, themeanaustrian.com. So that'll be linked at tomwoods.com/651 as the listener website mentioned. And of course, you know that I give shout outs to people who start their blogs or websites through my special link. And if you do that, then I'll give you the shout out, I'll put you on the show notes page, and I'll send you, if you ask for them, because maybe you don't need them, but if you ask for them, through the contact at tomwoods.com. I will also send you 24 free video tutorials on WordPress, the blogging platform you'll be using to help get you up and running really quickly. So check out my whole little package at tomwoods.com/publicity. And finally, I just wanted to give a plug for a free video series that's going to be up for only a very limited time. And it's basically about how you start up a virtual business. So a business that you could run from your computer while you're on vacation. Although if you're on vacation, what are you doing running your business? Enjoy yourself. But in other words, you can take it on the road. You can be anywhere. It's like me. I can do what I do from anywhere, absolutely anywhere. And I love that. I love that about what it is that I do. And I do a whole bunch of things that listeners don't even know about. And I can do all of those all over the place. Meanwhile, we have people who are worried about the security and the future of their jobs. Are their jobs going to be automated? Are robots going to be doing their jobs? And then meanwhile, you got these jerks running around the world running their businesses from their computers. Who are these people? Well, I wasn't always one of them myself, but I am one now, and I would not change a thing. Well, one of the people I learned from when I learned about how to do this is this guy, Eben Pagan, and he's got a new video series out, doesn't cost you a thing, showing exactly how to do this. What are the indispensable ingredients you need? How has he done it? Because he's started 10 businesses that have done in excess of $1 million in sales, several of them in excess of $10 million in sales. You know, you learn things after you do that repeatedly, and you learn what works and you learn what doesn't work. And he's synthesizing this in this free video series leading up to his virtual CEO course. So you can check out that free video series, which I highly recommend, through tomwoods.com/CEO. All right, that's it. Well, I'm going to talk to Scott Horton. He doesn't know it yet. I actually haven't asked him yet. So I sure hope this works. I'm going to try to get Scott Horton to come on and talk about Donald Trump's foreign policy speech that he gave about what his foreign policy would be. I haven't asked Scott yet, but he's the salt of the earth, Scott Horton. I know he's going to do it for me. So I'm telling you, and then I'm going to go tell him he's coming on my show to talk about that. Probably sometime early next week, I hope, if I'm lucky. All right, thanks for listening. See you then.
Become a smarter libertarian in just 30 minutes a day. Visit tomwoods.com to subscribe to the show for free, and we'll see you next time.